When you have difficulty falling asleep, in medical terms, you have what is called or what is referred to as insomnia. Emotional issues such as stress, such as anxiety, depression, causes half of all insomnia cases. But really, your daytime habits, your sleep routine, your physical health may also play a role. The most important thing is to try and identify all the possible causes of your insomnia. And once you are able to figure out all of the root causes, you can tailor your treatment accordingly. What are the possible causes of insomnia, of difficulty falling asleep? The first is anxiety, stress, depression. These are some of the most common causes of chronic insomnia. And also having difficulty falling asleep can make your anxiety, your stress level, your depressive symptoms get worse. Okay, so other emotional and psychological causes include anger, worry, grief, bipolar disorder, and also trauma. Number 2, medical problems or illnesses, including chronic pain problems, asthma, allergies, conditions such as Parkinson's disease, hyperthyroidism or any thyroid disease, acid reflux, kidney disease, and cancer can be some of those conditions that can cause difficulty falling asleep. And also, number 3, medications, including antidepressants, stimulants, medication for attentive disorders, ADHD, corticosteroids, thyroid hormones, medications for high blood pressure, especially diuretics. This medication can cause you to be awake several times at night to go pee. And also some contraceptives have been linked with insomnia. Number 4, sleep disorders. Some sleep disorders, including, for example, sleep apnea, conditions such as restless leg syndrome, circadian rhythm disturbances. It can be due to jet lag or late night shift work can actually disturb your sleep wake pattern in your brain. Another thing, number 5, what are the habits that actually causes insomnia? Let's zoom into the habits that can actually cause insomnia. One of the most common thing is excessive use of sleeping pills, or some people depends on alcohol to fall asleep. Okay, and also drinking excessive amount of coffee, especially during the daytime, and including irregular sleep schedule, napping at any time during the day, consumption of like sugary food, and also eating heavy meals, especially close to bedtime, and not getting enough exercise can cause difficulty falling asleep. So how can you manage insomnia? How can you manage difficulty falling asleep? Number 1, make sure your room is comfortable. You want an environment that is cool, that is calm. You want to reduce the lights. Excessive light can actually interfere with sleep. And number 2, you want to turn off all your screens, an hour before bed. Okay, when you turn off your screen, it actually help your body go to and achieve the state of rest faster and calmer. Okay, and also you want to avoid stimulating activity and situations before bedtime. For example, repeated checking of messages on social media. You want to avoid getting into big discussions or arguments before falling asleep. Okay, and also number 4, you want to avoid excessive day naps. If you feel like, for example, during the day you have to nap, you can limit your nap to 30 minutes, especially before 3 p.m. Number 5, you want to avoid consuming or drinking too many liquid. such as alcohol, or it's consuming large amount of evening meals, especially anytime after 6 or 7 p.m. And also you want to limit your alcohol consumption. Okay, what are the dietary supplements you can use for insomnia? Number one is melatonin. Melatonin is a naturally occurring hormone that your brain produces at night. These hormones can actually help you regulate, the sleep-wake cycle. Okay, do not use it excessively, because excessive use of melatonin, can have, its own side effects. Another medication is valerian. It's like an herb, which actually has a mild sedating effect, which can actually allows you, to sleep better. Okay, if you continue to have difficulty or persistent issues with your sleep, I think you have to speak with your sleep doctor so that he can zoom in and see what is really going on. I hope you're able to learn one or two things, during this presentation.